Well, this morning we're lucky enough to be interviewing a doctor, and we are going to be shining a light on lung cancer, specifically what you need to know about early detection. So, if you want to know more about this very important topic, please just stay tuned. Hey, good morning, everyone, and welcome to Scan FYI. My guest today is Dr. Ashley Jane McCormack. She's a thoracic surgeon. Good morning, doctor.
Good morning, Andrea.
Well, thank you so much for being with me this morning. We especially love the opportunity to speak to a doctor and talk about a very particular subject. So, if you would, Dr. McCormack, take a moment, introduce yourself a little bit more, and tell everyone about you.
First of all, thank you so much for having me. I'm very excited to be here and to speak about this very important topic that is very close to my heart. I am a thoracic surgeon here with the RWJ Barnabas Group. I recently joined, and I do specialize in the treatment of lung cancer, as well as other diseases of the chest, which may include esophageal cancer, tumors of the chest wall, the diaphragm, and the like.
So, for people who don't know exactly what a thoracic surgeon is or what they, why would I ever need to see one? Maybe just go over that a little bit because I think a lot of people don't know.
Of course. So, as a thoracic surgeon, we do specialized fellowship training in cardiac surgery and thoracic surgery. A lot of surgeons decide after that point whether to focus on cardiac surgery or thoracic surgery. Cardiac surgery meaning surgery of the heart, and then thoracic surgery involves other surgeries on the rest of the chest outside of the heart. So I chose to specialize in thoracic. So any diseases of the lung, benign and malignant, we are able to manage, as well as the esophagus. Like I said, the diaphragm as well, the mediastinum, which is the area mostly between your pericardium around your heart and the breastbone, as well as of the chest wall. So we are really specialists in those diseases.
So, for people who are listening, and again, I get to ask all the questions that everybody has. So, what might be some symptoms that I might have, or I see that someone in my family has, that would make me say, you know what, you should probably see someone who specializes, a thoracic surgeon?
So a lot of our patients do get referred from primary care physicians or from pulmonologists
Well, that makes sense.
or cardiologists. So it's a bit unusual for a patient to seek out our care initially on their own. Usually
Okay.
they will get referral. Um, the sneaky thing about lung cancer is that it does not cause symptoms. And when it does cause symptoms, it is often diagnosed at a later stage, which is why it is important, especially nowadays, that we are able to diagnose lung cancer early, before symptoms start. So then you have the greatest chance at a cure.
So we want to really be very specific now and talk about lung cancer because you said that that is an area, near and dear to your heart. And I will tell you that it's a scary diagnosis. I have a few friends who unfortunately passed away from lung cancer. And by the time it was even detected, by the time they even had a symptom, it was so far advanced.
Exactly.
So there was nothing that made them the least bit suspicious to say, I need to see someone. So
Right.
let's talk about that early detection.
So, first off, along those lines, lung cancer is the second most common cancer in both men behind prostate cancer and in women behind breast cancer. And I
Wow.
think in the United States, they're estimated that there's going to be about 225,000 new cases of lung cancer in 2025. Um, and along those lines, that accounts for about 125,000 deaths from lung cancer. So it is an incredibly scary diagnosis, and unfortunately, it is very common, which is why it is very important that we are able to detect it early. If you have a history of smoking, then you need to speak with your primary care physician, and see if you qualify for lung cancer screening. Lung cancer screening is a great way to detect lung cancer early. Patients undergo a yearly low-dose radiation CAT scan. And the point is not to pick up on very big nodules. The point of the low dose CAT scan is to pick up on some more subtle findings that may
Right.
be suspicious for cancer. And then after you get those CAT scans, we can decide whether you need to just repeat a CAT scan in a year or if there is a nodule that may be suspicious that needs further workup or evaluation.
All right, so I'm listening very carefully to what you're saying, and of course, I get it if you're a smoker. By the way, if you're a smoker, oh God, please don't stop right now. But if you're all right, so if you're a smoker, obviously you're going to be more susceptible. But what about I'm not a smoker? Would I still be someone who might want to be screened?
Unfortunately, the way the guidelines are written right now, non-smokers do not qualify for lung cancer screening. But of course, if you have a family history of lung cancer, you may be at a higher risk of
Okay.
developing lung cancer. So in that case, I do recommend that you speak to your primary care doctor about that, and your family history. And with
So,
that being, yeah.
oh no, no, go ahead, go ahead.
No, I was going to say, with that being said, about 19% of lung cancers in women and about 6% of lung cancers in men are found in patients who have never smoked.
Right. And
Yeah.
my friends who had lung cancer were non-smokers.
Yeah,
Interesting. So, but what do you have to say about secondhand smoke? You live with a smoker, let's say.
that is true. Um, of course, that will increase your risk
Mhm.
as well for a lung cancer, secondhand smoke, and sometimes, exposure to environmental pollutions increases your risk. There is no, again, those patients do not necessarily qualify for lung cancer screening, but it does certainly put you at a higher risk of developing a lung cancer.
Well, other than say so for again for people who are listening out there, so maybe you're not a smoker, maybe you don't live with a smoker, but what are some of the things that will make people more susceptible to contracting lung cancer? If I don't think contracting is the right word, but developing lung cancer.
Well, there's a lot of research going on about this. There are certainly some genetic markers that may make some patients more susceptible for developing a lung cancer. And along those lines, there are new treatments that target some of these genetic mutations so that patients can get targeted therapy if they do or if they are diagnosed with this lung cancer.
So if you get the early detection and it's detected, what's the treatment? What is the latest happening now with when somebody is diagnosed with lung cancer? Again, a very scary diagnosis.
Very scary. So there's four different ways to treat lung cancer, and depending on the patient, they may qualify for one or a combination of these different ways. Um, One is surgery, the other is radiation therapy, and then the last two are chemotherapy and immunotherapy. Patients who get diagnosed early, which means that the cancer is small and maybe it's just confined to the lung and not necessarily has spread yet, whether to the lymph nodes surrounding the lung, to other parts of the body. And those patients are best treated by surgery if they are good candidates for surgery and their pulmonary function, meaning their breathing tests, qualify them for surgery. For patients who have an early detection of lung cancer, but they don't necessarily qualify for surgery or they can't tolerate surgery because of their comorbidities or because of their poor breathing at baseline,
Right.
those patients we would offer radiation therapy for the treatment of their cancer. Once the cancer is removed surgically, we look at the final pathology results to determine if a patient would need what we call adjuvant treatment or more treatment after the surgery, or whether the surgery itself was curative. That's for patients with early stage cancer. For patients with more advanced cancer, the later stages, they may qualify for treatment up front, meaning some type of chemotherapy or immunotherapy or radiation therapy or a combination of. And then we reassess if they are candidates or not for surgery after those types of treatments. And then there's another group of patients who will never qualify for surgery, and those patients will just be treated with chemotherapy or immunotherapy or radiation.
With
So
early, well, with early detection, would you say that you're probably going to have a good outcome?
Again, it depends on the stage that the cancer is diagnosed. But the key is to diagnose it early before it has spread. And the 5-year survival for a stage 1 cancer that's, localized to the lung and hasn't spread elsewhere is over 90%. So
Okay.
that is why it's important for us to diagnose these cancers before they have spread. Certainly.
If someone is listening and they fall into the category of someone who would be eligible for, the screening for early detection, meaning I'm a smoker, is this something that you would go to your primary physician and tell them that you want to have the screening?
Absolutely. And it's important that you advocate for yourself and reach out to your primary care physician because, of course, many patients are more familiar with screening for colon cancer, like with a colonoscopy, or many patients get their mammograms for screening for breast cancer. And unfortunately, lung cancer screening is not as well known and talked about. So it is important that for patients to understand that they may qualify for it and to certainly bring it up to their primary care physicians who can order that scan. And if you do it through our system, we have nurse navigators who will reach out to the patient to make sure they're actually getting that scan and to discuss the results with them so that there's no loss to follow up after you get the CAT scan.
You really did strike a nerve about something to me because it's true. We get our mammograms, a colonoscopy, we get skin cancer, we check a lot of things out. But if you don't ask for something, you don't necessarily ever get it. And just because you go to your doctor and maybe your doctor, even your primary doctor, I mean, maybe they even know you're a smoker because it's in your chart. They
Mhm.
might not say to you, you should get screened, you should have lung cancer screening. So it's on you. You have to say, hey, I want this, right? You have to
Absolutely.
advocate.
Yeah, and
Yeah.
have that conversation with your primary care doctor and see if you qualify, and tell them about your smoking history. Absolutely. It's very important.
Like everything, early detection is key. And I didn't know that there was a screening for lung cancer. I
Mhm.
mean, I'm not a smoker, and excuse me, I'm an allergy person right now, but I'm not a smoker. So I just think that everything that you are entitled to get through your health coverage, you should take advantage of it because it could save
Absolutely.
your life, right?
Sure, absolutely. Without a doubt. And as you mentioned earlier that it's important to quit smoking. And I will say, even if you have a history of smoking, it's important to quit smoking now because you do reduce your risk of getting a lung cancer in the future. It never goes
Yeah.
back to a non-smoker. You're always going to be at an elevated risk. But the longer you have quit smoking, then the further you're able to reduce your risk of getting a lung cancer.
So if you have, but of course, even if you've never smoked, you could still develop lung cancer. That's
Absolutely.
the thing that some people are not realizing. And Dr. McCormack, sometimes you're out and about, and I see these young people like teenagers, and I see them smoking, and I just say to myself, with everything we know, with absolute 100%, we know this. Why are you smoking?
Right. And I know, vaping is a big thing too. There have not been enough studies that correlate vaping or, electronic cigarettes with developing lung cancer. But of course, that could certainly cause diseases in your lungs. So it's important to, encourage if you have a loved one in your family, a young person that is vaping or using e-cigarettes to encourage them to stop.
Potentially, it could be just as bad. We probably just don't know enough about it.
Correct. Yes, there haven't been enough studies done.
Because I do see lots of young people and people my age too. I see a lot of people vaping.
Yeah.
And, I'm not making any judgment here. I'm just
Oh,
saying there's so much that we know that's bad for us. And the worst that I ever see is when I see young people smoking. It bothers me. It really does. But we're only responsible for ourselves, right?
exactly. And of course, we all understand it's very hard to quit smoking. But you need to, there's definitely a lot of resources out there. And you need to find what works best for you. And it's important to talk to your doctor about, the best way for you to quit smoking.
Well, a big incentive to quit smoking, not to mention the money you're going to save, is that reducing your risk of lung cancer, which I did not realize was the second most common cancer. Did not
Yes.
realize that at all.
The
Yeah.
incidence has gone down as, as more people are aware that smoking causes lung cancer, but it is still very high. Yeah.
What is the age group where that is the most prevalent, lung cancer?
In older patients, so definitely around like 50s, 60s to 70s.
Okay, because it might be years of buildup from the smoking
Exactly.
and it finally
hmm
catches up with you. Okay,
Exactly.
makes sense. Well, Dr. McCormack, thank you so much for being with me this morning and really shining a light on this. If you out there are listening and you're smoking, please stop. If you are smoking, you should see your primary doctor and see if you are eligible to be screened for lung cancer, right?
Absolutely. Yes. Thank you so
Best
much for
advice
having
we
me.
can give you. Yep. All right. Again, all Dr. McCormack's info will be in the show notes. Doctor, thank you so much for being my guest today.
Thank you. It was a pleasure.
Remember out there, if it's important to you, it's important to us. I'm Andrea Tarr. We'll see you next time on Scan FYI. Bye, everyone, and bye, Dr. McCormack.
Bye.